Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, coming to you from our studios at the Capital Region International Airport. And we're going to stay in town. We're going to spend a little time with Karley Abramson. She's the Research Associate, High Health Policy with the Citizens Research Council, and that is in Livonia, Michigan, which, just by way of disclaimer, I grew up in Livonia, Michigan. So it's good to have you on. Karley, welcome to the show. Good to see you.
Thank you. Thank you for having me.
Could you give us a quick refresher of Citizens Research Council, what you are?
Sure. So Citizens Research Council is a nonprofit. We focus on nonpartisan, fact-based research for policymakers. A lot of our focus areas are on state government. We venture into local government as well. We have different topic areas. It's a pretty small group. And so we have a few researchers focusing on different topic areas. I focus on health policy in particular, but as you know, I will kind of discuss, health policy is very broad and covers a lot of different things. So there's a wide range of things that we write about. But yeah, just kind of tackling all different issues that are relevant to the policy world and to Michigan residents.
Well, and it's the research part that we're going to focus on today in this little interview. Your new report connects social determinants of health directly to Michigan's economic performance. What should all of our business leaders understand about how that affects us?
Yeah, so I don't know how much of this social determinants of health concept kind of makes its way into the business world. We are trying to get policymakers to focus on this issue. Essentially, it's a little bit of a difficult thing to capture because social determinants of health just means pretty much everything in the structure and system that impacts your health and kind of creates and leads to poor health outcomes. So we're talking about financial resources, access to healthcare, food and nutrition, general safety, which includes like transportation, community violence, all different kinds of things, and social support. And the main takeaway from the paper is how central those financial resources are to driving better health outcomes. And you know, there's different policy areas that you can kind of chip away at here and chip away at there, but essentially the research shows over and over again that having a more robust economy, raising incomes, and you know, getting people kind of more money in their pockets is the way toward better health outcomes. So for business leaders, there's a lot of different avenues, you know, towards that general goal. And so it's important for both policymakers and business leaders to have this shared goal in mind as as everyone's taking their next steps forward.
You know, there's a lot of ramifications with all of this, and one of those is that Michigan's health outcomes are kind of lagging behind some of our neighbor states, and
Mhm.
also on the international scene. To give us a little idea of some of these ramifications, and I guess I'm talking about absenteeism,
Yeah,
etc.
definitely. So there's a lot, like you said, the ripple effects of poor health outcomes um, can be very broad and is definitely shown in those lost weight, lost productivity. When people have poor health outcomes or are sicker, they miss work, they're less productive. Um, and you know, that is an important pathway for you know, creating a more prosperous economy. It's kind of this feedback loop of you need healthy people to contribute to the economy to make it better. But a well-functioning economy is what also helps make people healthier. And so you kind of get into that feedback loop that feeds into each other. But you know, absenteeism and these things can't be solved from one particular policy, but the effect, the economic impact of having a sicker population has been very much shown in the research. So there's a lot of ripple effects there.
No, you're absolutely right, and it is related economically. That sector suffers a little more than the
Yeah.
rest of it.
Mhm.
So, tell me a little bit about where we should be, where I should be in this, bringing policymakers and business people and everybody else together to talk about this problem.
Yeah, and this is where, you know, stop short in the paper because this is not my area of expertise. I'm not in the, the business world, the business leaders, but this is exactly the kind of conversation and questioning that we hope this paper generates among the experts in this field. And so that communication between policymakers and business leaders is going to be very important because there's a lot of different ways and a lot of different ideas about how to improve incomes. And so as business leaders, focusing on the things when you're, communicating with policymakers, the ones that will focus on achieving those goals, because healthcare is very expensive. Providing healthcare for your employees is very expensive. That money could be used on other things for your business. And so things that keep those healthcare costs down, which include healthier people, being able to access things, those are things that are going to directly help the business. And so just, again, making sure that everyone's on the same page with their priorities leading into any discussions about policies.
Yeah, I would say probably wellness is high up on that as well. A little preventative here and there.
Definitely.
Karley Abramson, thanks so much for spending time with us, Research Associate in Health Policy for the Citizens Research Council of Michigan and Livonia. Thanks so much.
Thank you for having me.
You're watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman. Stick around, there's more ahead.